This is the story of the tragic death of Candace Newmaker. Candace was a 10-year-old girl who died in 2000 during a controversial therapy session called rebirthing. The session was intended to help her with attachment disorder, but it ended in her death. The background. Candace Newmaker's early life was marked by multiple circumstances and heartbreaking adversity. She was born in Lincolnton, North Carolina, to a teenage mother and an abusive father on November 19, 1989. The environment she entered was far from nurturing and stable, characterized by neglect and abuse that posed significant risks to her well-being. Her early years were fraught with challenges. At a tender age, Candace, along with her younger brother and sister, faced the painful reality of being removed from their home due to the pervasive neglect and abuse they endured. The authorities intervened, recognizing the urgent need to protect these vulnerable children from further harm. This removal from her biological family marked a significant turning point in Candace's life. It presented an opportunity for a fresh start, a chance to escape the cycle of maltreatment that had plagued her early years. As a young child, she displayed behavioral problems, including aggression and self-harm, which significantly impacted her daily life and relationships. It was during this turbulent period that Candace was adopted at the age of 5 by Candace Newmaker, a compassionate and determined pediatric nurse practitioner. Jean's profession not only reflected her passion for helping children, but also equipped her with a deep understanding of the complexities of childhood development and mental health. Jean, driven by love and a strong desire to provide Candace with a nurturing environment, embarked on a journey of parenthood with unwavering dedication. Despite Candace's behavioral struggles, Jean remained committed to her daughter's well-being, seeing beyond the challenges and recognizes the potential for growth and healing. Together, Jean and Candace faced the difficulties head-on, navigating the complexities of behavioral issues and seeking solutions. Jean tirelessly researched various therapeutic approaches, hoping to find the right path to help Candace overcome her challenges and lead a fulfilling life. It was during this search that Jean came across rebirthing therapy, an unconventional and controversial treatment that claimed to address attachment disorders and traumatic experiences by reenacting the birth process. Intrigued by the possibility of providing Candace with a transformative experience, Jean saw rebirthing therapy as a potential avenue for healing and bonding. Jean's decision to explore rebirthing therapy for Candace was rooted in her unwavering belief in her daughter's potential. She hoped that by recreating the birth experience, Candace would have the opportunity to release repressed emotions from a stronger attachment with her and ultimately overcome the behavioral struggles. With therapy. Rebirthing therapy, also known as attachment therapy, was an unscientific and controversial therapeutic approach that gained attention in the late 20th century. It claimed to treat attachment disorders, trauma, and other psychological issues by recreating the experience of birth and facilitating emotional healing. The core concept of rebirthing therapy revolved around the idea that individuals who had experienced difficulties during their early development or birth process could benefit from reenacting their birth experience in a controlled setting. Proponents of this therapy believe that by recreating the birth scenario, individuals could release repressed emotions from a stronger attachment with their caregivers and resolve past traumas. During the rebirthing therapy sessions, the individual would often be tightly wrapped in blankets or sheets to mimic the feeling of being in the womb. The therapist and other participants would then simulate the birthing process by applying pressure, restraining the person, and encouraging them to struggle and push against the blankets. The intended goal was to facilitate a sense of catharsis, emotional release, and bonding. However, the methods used in rebirthing therapy were highly controversial and lacked scientific validity. Professional mental health organizations, such as the American Psychological Association, have strongly criticized and discredited rebirthing therapy due to its potential for harm. It's important to note that there is no evidence to support the effectiveness of rebirthing therapy, and it has been associated with serious risks and tragic outcomes. Candace's death. In the depths of January's chill, on the fateful day of January 6th of 2000, young Candace Newmaker was taken to the Evergreen Center, a residential treatment facility nestled in the picturesque landscapes of Evergreen, Colorado. Her hopeful heart partake in the session, a session that would ultimately lead to her tragic demise. Within the walls of the center, Candace found herself in the presence of two therapists, Carl Watkins and Julie Ponder, who were entrusted with her care. The air buzzed with anticipation as the session began. The room enveloped in a mix of hope and uncertainty. Candace, her youthful spirit shining through, stood before them, ready to embark on a journey she believed would change her life. Watkins, the architect of this therapeutic endeavor, gently wrapped Candace in a soft, comforting flannel sheet, tenderly cocooning her fragile form. It was an attempt to recreate the warmth and security of a mother's womb. With Candace swathed in the embrace of the flannel, Watkins assumed her role with solemn determination. She pressed Candace's frail frame to the floor, while Ponder, figure of support, stood upon her legs. The room trembled with a mix of trepidation and anticipation as the session unfolded. Watkins, her voice hushed yet commanding, beckoned Candace to get to an imagined journey, a journey back to her own birth. Picture yourself being born, she urged as her words carried the weight of possibility and emotional catharsis. The atmosphere grew charged with emotion as Candace, caught between reality and imagination, struggled against the constraints that held her down. With every fiber of her being, she fought against the invisible shackles that bound her, her young spirit desperately yearning for release. Minutes passed, Candace's struggle continued unabated. Her cries and pleas for help echoed through the room, carrying with them a plea for salvation. But the therapists, their vision clouded by misguided intentions, remained steadfast, unwilling to release her from the binds that suffocated her spirit. As the moments ticked by, a shroud of darkness descended upon Candace's fragile existence. Exhausted, overwhelmed, and without reprieve, her consciousness slipped away, stolen by the very forces meant to guide her toward truth. The air grew heavy with sorrow as her life force dissipated, her young heart silenced forever. The aftermath. The harrowing aftermath of Candace Newmaker's untimely death cast a spotlight on the dire consequences of unregulated and unproven therapeutic practices. The therapists responsible for her tragic demise faced the consequences of their actions. They were convicted of child abuse and sentenced to prison, held accountable for their role in the fateful rebirthing session that claimed Candace's life. This heart-wrenching event reverberated through the halls of justice and spurred a transformative wave of change, recognizing the urgent need to safeguard vulnerable individuals from similar harm. The case of Candace Newmaker propelled significant altercations in the regulation of alternative therapies across the United States. In 2002, the state of Colorado enacted the Candace Newmaker Child Protection Act, etching Candace's name into legislation that aimed to prevent future tragedies. This act mandates that therapists obtain a license before administering rebirthing therapy or similar approaches to children. The law further demands that therapists secure written consent from parents or legal guardians, ensuring they are fully informed and aware of the potential risks associated with such treatments. The passage of the Candace Newmaker Child Protection Act stands as a testament to the enduring impact of one young girl's life and the quest to prevent the recurrence of similar horrors. It serves as a solemn reminder that alternative therapies must be entrusted only to qualified professionals who adhere to established ethical guidelines and prioritize the safety and well-being of those under their care. The death of Candace Newmaker reverberated beyond her immediate circumstances, igniting a collective call for vigilance, regulation, and transparency in the realm of alternative therapy. It serves as a stark reminder to parents and guardians that when considering any form of unconventional treatment, it's paramount to seek out qualified professionals, thoroughly evaluate the evidence supporting such therapies, and be fully aware of the potential risks involved. Candace's early life was characterized by immense hardships. It was through the intervention of authorities and the love of her adopted mother that she found hope and the prospect of a better life. Her story is also a reminder of the importance of seeking professional help for children who are struggling with behavioral problems, and that alternative therapy should only be used with caution and under the supervision of a qualified professional.